Have you ever felt that really specific kind of nagging knee pain?
Hmm.
The kind that makes, climbing stairs feel like a major effort, or even just getting out of your car is suddenly hard work?
Yeah, or standing up after squatting down.
Exactly. It's not just like a general ache all over. It's this distinct feeling, almost like friction or grinding.
Yeah, very particular sensation.
And it turns everyday stuff into a real challenge. This specific pain, well, it often gets misunderstood, doesn't it? Sometimes even misdiagnosed.
It really does.
Oh.
Because the cause, and maybe more importantly, the best ways to treat it, aren't always obvious. They can be quite surprising.
So let's be clear, we're not just talking about knee arthritis in general today.
No, definitely not. We're doing a deep dive into a very specific kind of osteoarthritis. It's all about one particular part of the knee.
The kneecap, the patella.
Exactly. That crucial, but often kind of overlooked component right at the front.
Okay. So our mission for this deep dive, we want to help you really get your head around the knee's mechanics, which are surprisingly complex.
Yeah, they really are.
Understand why this specific issue with the kneecap pops up, and crucially, uncover some innovative ways to manage it.
And some of these are genuinely counterintuitive approaches.
Right. So the goal is for you listening to walk away really well informed about this joint and sort of the nuance involved in taking care of it.
Absolutely.
So let's jump in. What's the biggest thing people get wrong about how their knee actually works, especially when it comes to the kneecap?
Well, the D is genuinely one of the most complex joints we have.
Ugh.
It's amazing, really.
People think hinge,
Yeah.
right? Just back and forth.
Mostly, yeah. But it's so much more. You've got the bones, obviously, but then there's this really delicate balance of cartilage, ligaments, the joint capsule itself.
And all the supporting stuff, too. Muscles, nerves.
Muscles, blood vessels, nerves, the whole network. And I suppose the implication of all that complexity is that it's incredibly powerful.
But also vulnerable.
But also vulnerable to very specific problems, like the one we're discussing.
And right there at the front of this complex hinge is the patella, the kneecap.
One of the four main bones making up the knee joint: femur, tibia, fibula, and patella.
I always just pictured it as like a shield protecting the joint. But you're saying it's actually doing mechanical work. How does it optimize the quad muscle's force?
Oh, it's way more than just a shield.
Mhm.
It's cleverly designed to stop the quadriceps tendon, that big thigh muscle tendon, from rubbing directly on the thigh bone, the femur.
Because that would wear it out.
Very quickly. It would fray and tear. So the patella acts almost like a pulley or a roller.
A pulley, okay.
Yeah, it redirects the force and smooths the movement. So what does that mean for someone feeling this pain? Well, when it's all working perfectly.
Smooth sailing.
Exactly. The cartilage on the back of the kneecap and the cartilage in the groove on the femur, they just glide past each other. No friction. That's the ideal.
But things don't always stay ideal, do they? What happens when it's not smooth? I read it described almost like tiny imperfections, micro damage.
That's a good way to think about it, like tiny erosions or decay on the cartilage surface, specifically on the back of the patella.
Almost like cavities in teeth, but on your knee cartilage.
Kind of, yeah.
Yeah.
It's not just general wear. It's this specific surface breakdown,
Yeah,
degradation.
right. And that causes friction.
Precisely. And that friction, it doesn't just wear the cartilage out faster, though it does do that. It also creates significant inflammation.
Ah, inflammation. And that directly causes the symptoms you mentioned right at the start.
Yes, that specific pain that really flares up when you do activities that need you to bend the knee under load,
Climbing stairs,
getting in and out of the car,
standing up from a squat.
those are the classic ones.
Okay, so if this is happening, what can actually be done? It sounds like there are a few treatments, some pretty advanced ones. Platelet-rich plasma, PRP. That one sounds interesting.
Yes, PRP is definitely one of the key treatments. It uses the patient's own blood, which is pretty amazing.
Mm-hmm.
It taps into the body's natural healing mechanisms.
How does it work? Exactly.
It's actually quite straightforward in practice. We draw some blood, like a normal blood test. Then we process it in a centrifuge to concentrate the platelets.
Platelets, the things that help clotting.
They do that, but they're also packed with powerful growth factors. So we concentrate them, activate them, and then inject that concentrated plasma right into the knee joint.
And the idea is regeneration.
The goal is to use those growth factors to, ideally, help regenerate some of the damaged cartilage surface, or at the very least, significantly slow down the worsening of the arthritis. Reduce inflammation too.
So you're kind of boosting the body's own repair crew.
That's a great way to put it.
That makes sense. What else? What about people who might just have weaker cartilage to begin with? Maybe it runs in the family.
Yeah, that's a factor for some people. And our understanding here has really moved on. There are actually specific medications now.
Meds for cartilage.
Yes, that can help make the cartilage more resistant to wear and tear, even if someone has, say, a hereditary predisposition to weaker cartilage. These essentially work to sort of fortify it.
Make it tougher.
Make it harder, more durable over time. It's quite remarkable.
And you mentioned laser therapy too, high-power laser.
Right. High-power laser therapy is another important tool. This uses focused light energy.
Like heat.
Not exactly heat. It's more about stimulating the cells. It encourages cellular repair and improves blood flow in the area. This is really helpful for reducing inflammation, especially in the ligaments around the kneecap that get stressed and inflamed from all that friction.
Okay, so PRP, meds, laser. Now, this next one. This feels like the big one. The thing that might make people listening go, wait, what?
Ah, yes. The exercise component.
The idea that the wrong kind of exercise doesn't just, like, not help. It can actually hurt your kneecap.
This is absolutely critical and
Huh.
so often missed.
We're talking about avoiding those really common quad exercises, like the leg extension machine at the gym, where
Yeah.
you sit and straighten your leg against resistance.
Exactly those. Exercises that involve a lot of knee bending under load, especially in that open chain way, create direct friction and pressure on the patella against the femur.
So doing them can actually make the wear and tear worse.
Significantly worse, yes. It can accelerate the problem.
Wow. Okay. So what should the people be doing then, if not those?
Well, the focus needs to shift completely. It's about very specific exercises. They're designed not necessarily to just bulk up the quad muscle, but to strengthen the tendon supporting the kneecap.
The patellar tendon.
Yes, and also to optimize the stability of the entire knee structure, improving how all the muscles around the knee work together to control movement.
And this isn't something you should just guess at from a YouTube video.
Definitely not. This absolutely requires professional guidance. You need someone who understands the biomechanics.
Like a sports doctor or a physio who really specializes in knees.
Precisely. They can prescribe the right exercises, tailored to your specific situation, to build that stability without aggravating the patella.
So, wrong exercise harms, right exercise helps heal. That's a huge takeaway.
It really is. It underscores why getting that expert guidance for your exercise plan is paramount. It's about optimizing how the tendons work, how the whole structure supports the joint, creating really good stability.
Okay, stepping back then. What this all points to is, well, there's no single magic bullet, is there?
Not at all. It really highlights that a tailored, multifaceted approach is key. You're combining treatments,
Right, the PRP you mentioned.
the high-power laser,
The right medications if needed.
and crucially, those very specific, professionally guided exercises, putting all those pieces together.
That's how you manage this specific type of knee osteoarthritis effectively.
Yes, that comprehensive strategy.
And understanding this, applying this knowledge obviously under professional guidance, that can really mean much longer, healthier use of your knee, can't it?
Absolutely. It can significantly improve your quality of life. For you listening, it's not about just accepting the pain.
It's about being proactive,
Oh, yeah.
managing and preserving the joint.
Exactly. Taking active steps.
So maybe a final thought to leave people with. Given how nuanced this all is, how sometimes the common advice, like certain exercises, can actually be counterproductive, what does this whole deep dive tell us about seeking out highly specialized advice? Not just for knees, but maybe for any physical challenge we face.
That's a really important point. It really throws into relief the difference between general knowledge or, common wisdom and truly specialized expertise.
Relying on just general approaches might not cut it. Sometimes it might even be harmful.
It really makes you think, doesn't it? About the true value of finding someone who deeply understands the specifics of your particular issue. Expert guidance is often essential.